order this meeting of the Sacramento First 5.
Recording in progress.
I'd like to call to order this meeting of the Sacramento First 5 Commission for Monday, March 7th, 2022. Madam Clerk, will you please call the roll and establish a quorum?
Commissioner Serna.
Here.
Commissioner Saringer.
Here.
Commissioner Fernandez y Garcia, is not here today. Commissioner Gordon.
Here.
Commissioner Casirier.
Here.
Commissioner Wagstaff.
Here, please.
Commissioner Wirtz.
Here.
Commissioner Kennedy. Not here. Commissioner Hassett.
Here.
And Commissioner Turner Johnson. Here. Commissioner Evans.
Here.
Commissioner Kathari is not in. And Commissioner Moak.
Here.
Great, thank you. We have a quorum.
Great. Steph, can you put an image of the flag up for us, please?
There you are.
If you would kindly rise and join me in the pledge. Hand over heart. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right. I'm going to be glad when we can get rid of the clunky Pledge of Allegiance when we do remotely. All right. Again, I'd like to welcome everyone participating remotely in today's First 5 Commission meeting. It's our March meeting. We do have particular rules of engagement as we continue to function in this virtual environment. For commissioners, please note the following. Commissioners will be unmuted upon entering the Zoom meeting, and I ask that you mute yourself until you are called on to speak. Commissioners are encouraged to make comments and ask questions of staff throughout the meeting. Please use your raise hand button under participants when you would like to speak, and I will call you in order. Please lower your raised hand after you have been called on. Commissioners may see some questions pop up in the Q&A section. Please allow staff to answer those questions as they will primarily be related to making public comment. As far as the public participation goes, we would ask members of the public entering the Zoom meeting that to have the ability to signal that they would like to make a comment on any agenda item throughout the meeting. To be placed on the speakers list for any item, please click on the Q&A button and write your name and indicate the agenda item you wish to speak on. Please type into the Q&A at the beginning of the meeting or as soon as you know you would like to comment so that staff have time to create the speakers list. We will call your name in the order it was received and unmute you when it's your time to speak. The public calling in through the phone line will also have an opportunity to address the commission. If you have something to say when the phone line is unmuted, please state your name, the agenda item you wish to address, and then your comment. Public comment in the Zoom meeting or over the phone is limited to 3 minutes. And with that, if we could have Steph recite the Metro Cable playback statement, that would be great. You're on mute, Steph.
Let's try again. This meeting of the First 5 Sacramento Commission is cablecast live on Metro Cable 14, the local government affairs channel on the Comcast, Consolidated Communications, and AT&T Uverse cable systems. This meeting is closed captioned and live streamed at metro14live.saccounty.gov. Today's meeting will be repeated Saturday, March 12th at 3 p.m. on channel 14. This meeting can also be viewed at youtube.com/metrocable14.
Great, thank you. Okay, as I think our executive director noted, we do have a few commissioners, myself included, that have some hard stops today. So we will get on with our business. First item is approval of all virtual meetings pursuant to AB 361 due to ongoing public health concerns. And this is a voting item. Any commissioners have comments on this item? Seeing no hands raised. Madam Chair, Clerk, do we have any members of the public that wish to address the commission on this item?
No, we do not.
Okay, then I would entertain a motion at this point.
Move to accept.
Okay, it's been moved by Commissioner Wirtz. Is there a second?
I'll second.
Seconded by Commissioner Sneeringer. Madam Clerk, please call the roll.
Chair Serna,
Aye.
Commissioner Sneeringer,
Aye.
Commissioner Gordon,
Aye.
Commissioner Casirier,
Aye.
Commissioner Wagstaff,
Aye.
Commissioner Wirtz.
Aye.
Thank you. Motion passes.
Great, thank you. All right. Item 2 on our agenda under consent is approval of the February 7th, 2022 draft action summary. Any members of the commission wish to suggest any modification? Seeing none, no hands raised. Madam Clerk, do we have any members of the public signed up to address the commission on this item?
No, sir, we do not.
Okay, very good. In that case, I would entertain a motion.
Move approval.
Okay, it's been moved by Commissioner Wagstaff. Is there a second?
I'll second.
Second by Commissioner Sneeringer. Madam Clerk, please call the roll.
Chair Serna,
Aye.
Commissioner Sneeringer,
Aye.
Commissioner Gordon,
Aye.
Commissioner Casirier,
Aye.
Commissioner Wagstaff,
Aye.
Commissioner Wirtz.
Aye.
Thank you. Motion passes.
Very good, thank you. Now we're on to separate matters. Item 3 is public comments on off-agenda items. This is the public's opportunity to address the commission on any matter that is not on our published agenda. Madam Clerk, do we have anyone in the queue to address the commission on items not on the agenda?
No, sir, we do not.
All right, very good. Then in that case, we will move on to item 4 under separate matters, the executive director's report. Julie.
Thank you very much. Good to see you all today, and a few things to highlight from the director's report. The first is a brief update on the strategic plan. With this meeting, we are kicking off our first set of decision points related to the 2024 strategic plan. And we are starting a bit earlier with the process this year because we know that it will be different from previous years as we are really looking to incorporate a racial equity framework for our decision making. So we're excited to jump into the work. I'm pleased to announce that Lindsay Dunkel, who is the Commission's early care and education planner, is going to take the lead from the staff side. And Carmen Garcia Gomez, who has been our shepherd through several of the prior strategic planning processes, she'll continue to be a support throughout as well. And most of the staff do get very involved in the planning process. So more on that to come later on in the agenda. As related to our racial equity, diversity, and inclusion work, we have the responses to the Ready Plus Cultural Responsiveness survey that the commissioners, staff, and advisory committee members participated in last year. The results have been compiled, some recommendations have been created, and we are moving that work through our SOS committee and advisory committee so that those two committees will be meeting to review the results and have some deeper discussion really around how do we move those recommendations forward and make them sort of beyond recommendations but into reality. And from their feedback, we will take that and bring this item to you in our May Commission meeting, where we will speak with our racial justice advocates, consultants, and have a chance to dive into some of those recommendations. Staff are also actively engaged in efforts to plan and implement parent leadership and advocacy opportunities. We're exploring a variety of ways for parents to engage with us and with each other, including online learning. We are doing a self-paced option, and we are exploring a formal program called Parent Leadership Training Institute. So more to come as we figure out the various options for our parent engagement. And then finally, around this area, we continue to partner with Impact Foundry. We are offering free registration to the What If Conference, which is the largest gathering of nonprofits in our region. Many of our funded partners participate in this. And if any commissioners are interested in attending, please just reach out to Latina. We have a free registration code that we can provide for you. Moving on to Afghan refugee services, we're anxiously awaiting the first 5 California refugee assistance RFP, which is expected just in a few days, actually. The staff are planning to hold a listening session with Afghan parents and providers to gain their insight into what the biggest needs, opportunities, and assets are here in Sacramento. And then we'll use that information to develop our proposal. And if we are successful, we would distribute funding around that proposal and the activities that we discuss and hear about from the listening session. So over the next couple of months, we will be deeply engaged in that process as well.
Julie, can I interrupt? I see that
Sure.
Commissioner Wagstaff has his hand up.
Absolutely.
Thank you, Mr. Chair. Julie, thanks for the report. I just wanted to quickly note on the Afghan refugee services that you might, in working on this, connect with our Department of Human Assistance, specifically Paul Lake, Ethan Dye. I'm showing my age, sorry. Anyway, Ethan Dye, who is working as well on a contract with some nonprofits in this area, and I think it'd be useful if you guys compared notes.
Fantastic.
It might be useful to call Paul Lake too, I don't know, but call Ethan Dye.
Thank you. I will definitely do that. We have this year's First 5 Advocacy Day will be held virtually again on April 19th. And I wanted to give a special shout out to Commissioners Evans and Sneeringer for agreeing to join me and Aaron for the virtual meetings that will be scheduled with our legislators. So more on that later. And then we helped convene and recruit parents and providers to a childcare forum. Was that last month? It felt like it was last weekend. It might have been last weekend. Our staff, our lead staffer on this, Lindsay Dunkel, participated in the panel. She was joined by childcare advocates and frustrated parents. The event was in Oak Park. And it really helped. The purpose was to have some of our elected officials hear about the needs around childcare and address some short and long-term solutions for any additional funding like ARPA funding or state dollars coming down. We were really happy that Assemblymember McCarty joined the forum. He ended up sitting right alongside the panelists. He took a lot of questions. He was brainstorming ideas, and it stayed for over an hour. So it was pretty impressive. And he really answered quite a few questions from the providers around the impact of universal pre-kindergarten on the 3- and 4-year-old population that might impact childcare providers. And then I have just 2 things that are not actually in your report, but happened just between the writing of it and today. And one is that we were able to schedule a regional home visiting summit. First 5 Sacramento took the lead with Alejandro Labrado, our lead staffer on this. to coordinate a regional summit for home visitors from Sacramento and 8 other surrounding counties. So the event will be on April 26th. We have a guest speaker, Dr. Ernie Mendez, and he's going to facilitate a summit dedicated to supporting home visiting and family support service staff. And it's a really important topic because a recent home visiting workforce study conducted by First Five or funded by First Five California showed that home visitors are working almost twice as many hours as they were before COVID struck, and that a quarter of the home visiting workforce said that they reported depressive symptoms, depression and anxiety. About half of the people who responded to the survey also would like additional mental health supports. And all of those things were really seen as potentially impacting the workforce, the home visiting workforce, and causing turnover. So I think it's a really timely summit with a really important topic on self-care for our home visiting staff. And then I'm really happy to say that First Five California named Jackie Wong as their incoming executive director. She has been the deputy director for the past year and working very closely with Camille, who is staying on through this month so that they can overlap duties. She is the first woman of color to lead the First Five California Commission, and she lives right across the river from us in West Sacramento. She's a Yolo County person. So that's exciting. And that concludes my presentation.
Great, thank you, Julie. Any commissioners have any questions or comments in response to Julie's report? Don't see any hands up. Madam Clerk, do we have any members of the public that would like to address the commission regarding the executive director report?
No, we do not have anybody signed up to speak.
All right, thank you, Julie.
Okay, thank you.
All right, number 5 on our separate matters agenda is the advisory committee update.
Yes, indeed. Okay, so we met on February 18th. We had a very full meeting. It started with a meet and greet with Commissioner Turner Johnson. They asked so many wonderful questions and it was very interactive. So I'm just not here to give props, but I really appreciate the commissioners coming to meet the advisory committee members.
She is here.
Oh, she did join. Okay, great. I'm sorry, I didn't see you, Commissioner Turner Johnson, but thank you very, very much. And we also made some appointments to some of the subcommittees, and we discussed the next steps for the recommendations that came from the READY assessment. And we wrapped up the meeting with a presentation from member Carolyn Curtis on her trauma-informed curriculum entitled Me and My Emotions. And then I have one other piece of news here, which is kind of a blow to us. But we learned just last week that Bob Silva, who has been the longtime chair of the advisory committee, took a new position at SETA. And it's not necessarily related to preschool and Head Start side of the house anymore. So he's resigned as our chair. And he was just a constant support to me personally and to the staff and his fellow advisory committee members. He's going to be really greatly missed. And with his absence, we now also have several other open seats on the committee at this time, and we're actively recruiting. So please, as commissioners, if you know of someone great out there in community doing wonderful work with children and families who might be interested, please forward them on to me, and I would be happy to do an informational interview with them. And that's that.
All right, great, thank you. Any questions of Julie as it concerns the advisory committee update? Seeing none, Madam Clerk, do we have any members of the public that wish to address the commission on this matter?
No, we do not.
Right, very good. And we'll move on to item 6, which is our evaluation committee update.
Thank you, Chair. The evaluation committee met on January 24th, and I reported on that in our February meeting. So no further updates other than ongoing input into the annual report, evaluation report that you can hear more about today. Our next meeting will be on March 21st, and that's our report.
Great. Thank you, Commissioner Wirtz. Any questions of Commissioner Wirtz? Seeing none. Madam Clerk, do we have any members of the public that would like to address the commission on the evaluation committee update?
No, we do not.
Very good. Thank you. We'll move on to item 7, which is the financial planning committee update.
We did not meet.
Okay, thank you. All right. We are on to item 8. This is the Systems Optimization and Sustainability Committee update.
I'm so glad you get to say that, fella, not me. So the committee met on February 18th. I actually did not attend, so it was chaired by Commissioner Fernandez y Garcia. So we're tag teaming here to get this information to all of you. The committee received a presentation from Eric Harold on revenue and budgeting and briefly discussed the recommendations of RGA resulting in the internal survey. We're planning to have a special meeting later this month to further discuss recommendations and next steps. And the committee members agreed to move our meeting to every other month on the 3rd Tuesday of the month for the rest of 2022. And our next meeting is April 19th from 12 to 1.
Great. Thank you, Donna. Any questions for Commissioner Sneeringer? Seeing none, Madam Clerk, do we have any members of the public that would like to address the commission on this update?
No, we do not.
Okay, very good. Thank you. On to item 9. This is a public hearing item, the annual review of the first 5 Sacramento 2021-2024 strategic plan.
I believe Carmen is going to do double duty on this and take this item for the commission.
Before she does, just a point of order. I have in my notes here no vote, but it's a public hearing. Is that correct? So we're opening a public hearing and not voting on it.
Says we have to have a public hearing, but I think we usually do approve it, Phil, to not make any changes to it. So
I'm gonna seek the advice of Mr. Hire here.
oh, that's good.
Since it was not noticed as an action item, but just a public hearing, I suggest just having the public hearing, receiving any comments, and then we can consider those and bring them back for on the next one to ratify if that's the commission's preference.
Very good. So noted, and we will do exactly that. Okay, so Carmen.
Great. Thank you. Good afternoon, commissioners. Today, I'm going to present the annual review of the first 5 Sacramento strategic plan for fiscal years 21-24. We are currently operating the first fiscal year of the 3-year strategic plan, which was approved by your commission on May 4th, 2021. The implementation plan and systems improvement plan was approved on August 3rd, 2020. And the expenditure for the 3-year strategic plan period totals $44.6 million. At this time, we are not asking for any changes to the strategic plan to continue on as is. The public hearing will satisfy the requirements of the various statutes of the Children and Families Act of 1998. And this concludes my report.
Very good. Thank you, Carmen. And do we have any members of the, I see that Commissioner Wirtz has his hand up. Commissioner Wirtz.
Thank you. Just a question, given COVID and the difficulty of carrying out some of the services and challenges and so on, are there any changes in terms of savings of funding that are just going to be carried over to the next years, or is that a mischaracterization?
I I'll let Eric jump in after me on this one so we can tag team it. But almost all of the providers, because this is the first year of the new strategic plan, almost all of the contractors received at least a 20% reduction in their budgets this year, because we had an overall 20 to 25% reduction going into this new plan. With that, we do not think that we're going to see the amount of rollover or return to the fund balance that we had in the prior year. But Eric, please feel free to jump in.
Yeah, it won't be at the same levels. We will have a fund balance. So any unspent funds will go into that fund balance and be considered for use in the next strategic plan period. Is that what you're asking, Steve? Commissioner Wertz?
Yeah.
Okay.
But we're not anticipating 3 million, kind of like that was an anomaly that happened, with the COVID year. But I don't, we typically have about, Eric, is it like 4 to 8% of our contractors don't spend everything, they leave 4 to 8% on the table.
Yeah, typically they'll go 4 to 9%. Also, just as a reminder, that what also affects the fund balance is the amount of revenues. And so we've been experiencing a higher backfill from Prop 64. So that also increases the fund balance that will be put in and considered for the next strategic plan period.
Okay. I see a thumbs up by Commissioner Wertz, so appreciate the response. Any other commissioners have questions? Okay. Madam Clerk, do we have any members of the public that wish to address? Look, first, let me open the public hearing officially and ask the clerk if we have any members of the public that would like to address the commission on this item.
We do not have anybody signed up to speak on this item.
Okay, then I will officially close the record on this. And again, citing the fact that there is not, this was not published as an action item, and taking the advice from council, we will, I assume, take action at a forthcoming commission meeting. With that, we'll move on to item 10. And this is approval of the 2024 strategic plan timeline and release of RFA for strategic plan facilitation. Julie?
Thank you. Super excited about this. Today, we're going to begin making decisions that will guide the development of the 2024 strategic plan. And the biggest change for the upcoming process will be that we are centering it in racial equity, diversity, and inclusion. So a year ago, as you'll recall, the Commission approved our resolution on racial equity and social justice. And that document has been our North Star for reimagining this process. It's the reason that we want to co-create the strategic plan with the whole commission and with all of the staff and our advisory committee and the community. I think Lindsay was going to share some slides here. There we go. There we go. Perfect. I think we're on to the next one, actually, Lindsay. There we go. So what does the change look like? Well, rather than asking you to appoint 3 commissioners and 2 advisory committee members to an ad hoc work group, we're going to engage in decision-making as a whole commission, starting today, and then at every meeting through May of 2023. 2 meetings, which we hope to have outside of board chambers, in a more sort of retreat style setting, would take place in October and December. Next slide, please. And so what does this mean? So commissioners will move from having like that a primary role as a decision maker for work that has been done in the subcommittee to being much more inclusive and engaged in the role over the next 14 months. We're asking that you pre-read materials. Oops.
Sorry.
It's okay, at least it's not mine. Pre-read materials before the meeting so that we can have really robust discussions. We ask that commissioners co-create the vision and mission statements and identify our foundational principles. You'll all get a chance to review our data on maternal, child, and family well-being, as well as racial disparities, and the community voice about what the assets, needs, and approaches are from their perspective. And finally, we ask that all engage in deep discussion around the data and your values in order to come to decisions about funding priorities. Next slide, please. This is a timeline, and there is also one in your packet, but the timeline for strategic planning activities may change once our contractor's on board. So we built in some additional time, and we're starting a couple months earlier than we normally do. First Five is an evolutionary, our work is an evolutionary process. And now that we've really seen the power of collective impact in our RAACD work, it's very much opened us up to new possibilities. We want to ensure there's time in our process to hear from potential partners, especially as it relates to work with our children and families of color. A narrative version of this is in your packet. The decision points are identified at each meeting when we know, because we still haven't been able to get all the decision points because we don't have our consultant on board, but they are marked in bold when we do know. Next slide, please. This slide really kind of spoke to both Lindsay and me. White supremacy culture cuts across most, if not all, of our systems that serve children and families. Many of you might recognize some of these characteristics, how they possibly show up at your agency, or if you've seen them show up at First Five. At a recent Ready workshop provided by First Five California, First Five Association, Lindsay and I were struck by this, created by First Five San Francisco, or used by First Five San Francisco when they were doing their recent strategic planning process. And this was really interesting because it sort of shows how those characters map onto what we do in our strategic planning. And so the next slide, please. This I thought is a really good example of the ways in which that happens. And to me, this slide represents a part of our why. So this is why we're changing the process and our timeline and how much we're investing in strategic planning, both financially, but also in the shape of commissioner and staff engagement. When I look at these examples, I recognize that several have shown up in our earlier strategic planning processes. And that just really reaffirms that this is the water that we swim in, right? Like we can't even see it until we step out of it and intentionally look for it. And in the end, it's not about the right or wrong of past processes. What it's really about for us is know better, do better. And that's why we're really excited by this reimagined process. And this is our attempt to do better by our children and families. So for our first step on this path, we have 2 items for your discussion and approval today. We have the preliminary timeline in your packet, which may change when we get our consultants on board. And currently what we believe will happen are the bolded items, those decision points at each commission meeting. And then we're also requesting approval to release an RFA for strategic planning consultant or agency. The allocation for $55,000 includes the consultant to co-create the strategic planning process with staff and commissioners, the entire facilitation of community engagement along with staff again, and hopefully our advisory committee, really bringing in our advisory committee members to be a link between the community and the commission. They will facilitate the meetings and retreats, both at commission and potentially at advisory committee, and serve as thought partners for the staff in this work. And finally, they'll produce a strategic plan document for us. So those are the actions for today. And that concludes the formal presentation part, but we really did want to leave some time for commissioner discussion about the new process and how it sits with you, in what ways does it possibly mesh with your vision of centering racial equity in our process. If you have any concerns about it, if there's anything you want us to really know, because we're not going to meet next month, but we're going to continue on with getting our consultant on board. So sort of any guidance you might have for us, just wide open. We'd love to hear your thoughts.
Great, thank you, Julie.
Sure.
Okay, so first of all, I assume, Mr. Heyer, that we can take both action items together. They are presented on our agenda as one agenda item.
Yes.
Okay, very good. Okay, with that, any questions or comments, suggestions from commissioners? Commissioner Wirtz.
Thank you again. I'm impressed. I really like those slides to sort of highlight. Those are things that most of us do in swimming in the water in general. And so I think it's very good to surface those for us. And I appreciate that effort. In terms of any suggestions, one thought I have, and that's probably well underway as we speak, but I'm just thinking of all of the culturally designed nonprofits and community activist groups. I just think it would be very interesting to reach broadly, to reach out to as many of the organizations, not just service organizations, but organizations that work in the Sacramento area, to get some input from them around how they see serving their communities and the issues that might be barriers or challenges or strengths. And I'm not sure we've done that in the past, and we've done individual surveys, but I'm thinking of reaching out to actual organizations that serve the SETAs but groups as churches or other activist groups around homelessness and the Poor People's Campaign and so on. I think they might give us a different view of things around families and children than we might normally see. So just my suggestion.
Thank you. Good suggestion.
Great. Thank you, Commissioner Wirtz. Dr. Kasiri.
Thank you. I just wanted to commend you again for being willing to and open to doing things differently, and also to start the difficult conversations, because I know that these are not always easy, and it does take some commitment to go through that process. I also do agree with what Commissioner Wirtz said about involvement of the community. I think some of the criticism that we get as a county is that even when we're seeking community input, it's more like checking a box, and that I'm hoping that we will put more thought into that and being able to get more broad participation from the community that we want to serve. Thank you.
Great suggestion. Thank you. All right. Any others? Don't see any hands. Okay. Thank you for your presentation, Julie. And this does require a vote. And again,
I'm happy to move both items, Chair.
Very good. Thank you, Commissioner Gordon. We have a first from Commissioner Gordon. Is there a second?
I'll second.
And second by Commissioner Sneeringer. Madam Clerk, do we have any members of the public that want to address us on this?
No, we don't have anybody signed up to speak.
Okay, very good. All right. With that, we have a first and a second. Will you please call the roll?
Chair Serna,
Aye.
Commissioner Sneeringer,
Aye.
Commissioner Turner Johnson.
I saw. I think she said aye. She's muted.
I forgot one important thing, which was to unmute. Of course, I said aye. Sorry about that.
You're fine, thank you. Commissioner Gordon,
Aye.
Commissioner Casirier,
Aye.
Commissioner Wagstaff,
Aye.
Commissioner Wertz.
Aye.
Thank you. Motion passes.
All right, very good. Thank you all. With that, we'll move on to item 11. This is a presentation. It's the first five Sacramento Annual Evaluation Report for 2020-21.
Great. And for this, we have Alyssa Mullins, our representative from ASR, to give us the presentation in PowerPoint.
I'm going to start sharing my screen. 1 second. Okay. So thank you for the introduction from Julie. My name is Alyssa Mullins, and I'll be presenting the summary of the findings from the evaluation report for the fiscal year 2020 to 2021 on behalf of Applied Survey Research. So the first slide will provide an overview of the first five strategic hierarchy that guided the programming and evaluation for fiscal years 2018 through 2021. Under the priorities of health, early care and development, and empowered families, there are five main goals for children and families in Sacramento. All children are healthy, all children are in an environment conducive to their development, all children enter kindergarten ready to learn, and all families connect to communities and families support children's development and safety. These goals are measured through 10 result areas that include direct service and systems efforts. With these results, goals, and priorities in mind, ASR evaluates first five efforts using a results-based accountability or RBA framework. We measure how much was done, how well it was done, and is anyone better off to identify the impact of programs on these larger goals and result areas. The annual report includes the findings from this RBA approach, as well as key successes and opportunities for improvement during 2020-21, as well as consideration of the impact of COVID. So as programs adapted to health and safety requirements, it's important to think about things like reduced capacity and challenges meeting milestones due to families with hesitancy, technical challenges, and other pressing concerns, as well as the more positive and innovative ways that programs were able to reach more families when social connection and support were greatly needed. Looking at the overall reach of First Five during 2020-21, First Five programs served about 18,000 caregivers and almost 8,000 children, which is about 7% of the children 5 and under in Sacramento County. And as a side note, these numbers represent the unduplicated individuals directly served, while First Five initiatives have a much larger reach through systems change interventions like water fluoridation efforts, dental clinics, public education and social media, and the 2-in-1 call center. And this slide shows the race ethnicity of the children served by First Five. We can see that more than half of the children served were either Hispanic Latino or Black African American, while these two groups comprise about 40% of the children in Sacramento County. Okay, first moving on to the first result area, or the first priority area where the First Five goal is that all children are healthy. So the first result area prioritizes the reduction of infant deaths, and we presented on the reduction of African American child deaths, or RAACD initiative, last month. So I'll just provide a brief recap of some of those highlights. The Black Mothers United Pregnancy Peer Support Program served 159 pregnant women. Clients delivered 85 live births in 2020-21. 76% of those had a healthy birth weight and were full term. And importantly, there were 0 stillbirths or infant deaths for the second consecutive year. The Safe Sleep Baby campaign served 691 parents and caregivers, and trainings resulted in significant improvements in knowledge on infant safe sleep and increase infant safe sleep practices. The Unequal Birth Public Education Campaign, which identifies racism as the root cause of racial disparities in safe birth outcomes, received 1.6 million impressions on social media, exceeded the industry benchmark for clicks, and had about 200 website clicks on the Take Action page. And the Birth and Beyond Family Resource Centers served over 5,000 adults and children with home visits, parent education workshops, crisis intervention, and enhanced course services with a goal of reducing child abuse and maltreatment. These efforts continue to contribute in part to an overall reduction of African American child deaths countywide. Compared with the 2012-2014 baseline, African American infant mortality had decreased 17%, which exceeded the Blue Ribbon Commission's goal for 2020. Next, First Five funded efforts to increase the prevalence and duration of breastfeeding. The Department of Health and Human Services and the Community Resource Project WIC programs reached 2,800 mothers to promote services and provided over 2,000 brief support helpline services, nearly 1,400 moderate drop-in support services, and almost 1,700 extensive support consultations with international board certified lactation consultants, which includes a full assessment, triage, and assistance for more complex issues.
Alyssa, can I interrupt?
Yes.
Commissioner Wagstaff has his hand up.
Oh, yep. Sorry, I can't see both screens.
Thank you, Chair. I was trying to get in while you were still back on the African American death information, and I wanted to call out what I thought was a very significant finding. We're certainly all pleased about the data that was shared here, but I think it is worth noting the information on page 13 about the situation with preterm and low weight birth weight babies. And that the percentage of African American infants who are born preterm is still substantially higher than state and county rates. I thought that was something that we shouldn't just skip over, frankly. And that as you look at this, it says these rates have increased to 13% during the 3-year period that we're looking at. So I just wanted to call that attention out to the commission for our future consideration, that I just didn't want us to pass over this, that this is, I think, a significant situation. I would suggest that this be something that we have on our radar, certainly, but also in terms of not just reducing these rates of preterm babies in the African American community, but also looking for ways to work with families when they do have preterm babies and how you can still ensure successful outcomes. I know that I had 2 in my family, and this strikes me as on a personal level, quite frankly, and that in our case, we are very fortunate, and our kids are doing great. They're adults now, et cetera, et cetera. But this is not something I just want us to pass over. That I think this is something that, Julie, that we should track, we should keep our eyes on, and we should look for ways to affect by bringing the rates down, but also recognizing that the secondary part of this is to work with families who do have preterm kids, because there's still lots of ways you can have good outcomes for those kids. And also, it's just one question to our evaluator here. It says that the goal here, we're at 13% right now, and it says the healthy people goal in this area is to reach 9.4% by 2030. Do you know how that goal of 9.4% was reached, or how that was established?
I'm not personally familiar with the details of the Healthy People 2030 or the 2020 was the prior number. I'm not exactly sure how that's calculated. I don't know if anyone else on the call has more experience having read through those nationwide reports. But one thing to kind of draw attention to that is we actually, in terms of the preterm and low birth rate, we're actually seeing the same kind of trend getting worse nationwide as well. So that's actually something that is called out in that report as well. And I see Julie might have more insight into those reports.
Before we get to Julie, that's quite true, but it does point out in the report that our rates in Sacramento County are above what you see statewide and nationally. And I just think that's worth noting, definitely.
Definitely.
Julie? You're on mute, Julie.
I was off mute. I put myself on mute for my comment. Okay. I do not know the criteria about how they create the healthy people benchmarks every decade. But I do have good news around what might help us even further impact and prevent, but also what you were talking about, Commissioner Wagstaff, which is sort of wrapping those families with preterm babies in services, embracing them and connecting them. And so there's two things that the Board of Supervisors approved in January with the ARPA funding. And one of them specifically was out of Dr. Cassirier's department for community public health nursing, the return of community public health nursing, which I just think is going to be a critical, because you've got home visitors that are seeing these women who've just given birth and are being discharged from the hospital with these little babies, but there was no follow-up necessarily that really meets the needs, like a public health nurse going to their home and connecting with them. And with that new funding from ARPA, at least for the next 3 years, that's going to be a game changer, I think, for parents leaving the hospital with little ones. That and the new community family support navigators that will be stationed at each of the community incubator leads and the FRCs, also through the ARPA funding. I think these are two brand new resources that are going to make a big difference.
Thank you.
Thank you. Commissioner Turner-Johnson.
Yeah, just to follow up on this is such a good point, and it's such a ongoing and complex, topic, of course. And my point is that I think that tracking, I know from my own background experience, in Oakland with so many children and babies that we had in early Head Start, that if the tracking time is not elongated beyond the initial healthy baby visit to the home with whatever materials and so forth, if we can't find, as Julie's graciously now suggested, that we have the funding that allows us to go into, I don't know if there is any perfect amount of time, but from my own experience, I would say, up to 24 months minimum, as those first 4 years or so after a preemie are how you begin to know that the child, I won't go into all the domains, but across all 8 domains that you're showing, progress, all right, and a degree of stability and normalcy that doesn't require other specialized interventions. Because if it does, we all know from the research, evidence-based research, that the earlier the intervention, the better outcome for the child. So I'll just add that to what is clearly that Commissioner Wagstaff brought up an incredibly important point here.
Thank you.
Thank you, Commissioner. Any other questions before we continue with Alyssa's presentation? All right, seeing none, go ahead.
Thank you. And as a note to that, I do think that in the RAACD report, I think that was one of our recommendations as well, was to monitor those increasing trends, as well as, because this is a nationwide increase that we're seeing as well across various ethnicities, as well as to really kind of identify best practices that other communities might be using as well in order to implement it. So I think there's a lot of potential to join up, within the Sacramento County community, as well as across the state and nationwide, to be able to identify some of these ways to help families more, both in prevention and response. Okay, we're going to go back to breastfeeding. So we were just talking about the 2,800 women, mothers served by the 2 WIC programs. And then among the mothers that were reached at their 6-month follow-up, more than half reported that they were exclusively breastfeeding, which exceeds the most current statewide estimates, as well as both the Healthy People 2020 and Healthy People 2030 targets. And as one mother described after receiving support from a lactation consultant, While she was on the brink of giving up on breastfeeding, the support she received made her so happy to be able to give her baby something so valuable. In terms of the efforts to decrease dental disease, Early Smiles screened about 1,200 children. While this number was much lower than previous years due to COVID health and safety requirements, the proportion needing non-urgent or urgent care was similar to the 2019-2020 proportions as well. And in order to reach more families during COVID, Early Smiles also developed an oral health education video in English and in Spanish, which received about 500 views during the fiscal year. Okay, to highlight some of the health-related systems efforts, the Commission's funding on water fluoridation continues to significantly increase fluoridation facilities in Sacramento County and provides more than 2/3 of Sacramento County's children with fluoridated drinking water. The Systems Optimization and Sustainability Committee, formerly the Sustainability Committee, works on the Commission's racial equity, diversity and inclusion, and cultural responsiveness work, in addition to systems improvement, sustainability, and policy and advocacy efforts. And additionally, national and statewide responses to the COVID pandemic, such as the California Earned Income Tax Credit, expanded paid family leave, and the American Rescue Act has supported the health of Sacramento families as well. Moving on to the second priority area, which strives to ensure that all children are in an environment conducive to their development and all children enter kindergarten ready to learn. First, early education settings received education, assessments, and technical support to improve the quality of care, with a focus on family child care homes and child care centers not otherwise receiving state funding and support. So while COVID impacted in-person assessments and evaluations for both the Quality Child Care Collaborative and the Preschool Bridging Model Plus programs, together these programs provided support and education to 231 early educators. And PBM Plus also provided nearly 400 children developmental screenings, 50 of which were referred to additional services. Next, to support children and families' kindergarten readiness, Help Me Grow supported nearly 1,000 families that called into the call center for developmental and early care support and conducted 474 developmental screenings. Help Me Grow family advocates also conducted about 350 home visits with families during the 2020-21 fiscal year. And additionally, over 1,800 children received developmental screenings by the school districts in the School Readiness Initiative, 162 of which were referred to additional services. Together, the 9 school districts in the initiative supported over 2,600 children and 2,100 parents and caregivers. And First Five also funded the equivalent of 59 preschool slots in 2 of the school districts, and over 300 families attended playgroups. Lastly, 317 children attended transition summer camps and 239 parents attended transition orientation to aid in families and children's readiness and knowledge of what to expect in kindergarten. On average, the children who attended transition summer camps had significant improvements in their kindergarten academics, self-regulation, and social expression. Our last priority area strives to empower families' connection to communities and their ability. Yes.
Oh, just to pause you, we have 2 questions from commissioners.
Okay.
If you want those before we go to the third area.
Commissioner Turner Johnson, do you still have your hand raised from the previous question, or do you have a new question? Okay, looks like she took her hand down. All right, Commissioner Wagstaff.
Thank you, Chair. On this section, if I could, on page 48 of the report, on preschool, you have a chart, and on which is very helpful. But on the question of is anyone better off, which I think is a key question in all these things, you've got N/A, which is either not applicable or not available. Can you speak to that? You also have the same entry for the playgroups. Some good data on how it was done and how much folks were reached, but on the question of is anyone better off, which again I think is a key question, you have N/A. Can you speak to that, please?
Sure. Sorry, I'm trying to pull up the report now. So can you tell me what figure number you're looking at?
Well, I'm looking at the chart on page 48 and the chart on page 49 of the material that was with our agenda package, which is the report, the evaluation report. And again, you have a dashboard, and having these dashboards is very helpful. But
Sure.
On the question of anyone better off,
Sure. So both of those just mean that there's not currently a measure of those pieces of the RBA. So we don't currently have a measure of is anyone better off based on the available data.
So you know, I think somebody else is trying to chime in, but I think I understand that. But you know, another way of saying that is we don't know whether these efforts made a difference.
If I can add, we used to have measures. We did have measures prior to COVID. And because if you see, we had 18 children that attended preschool. It was very difficult to do. They were doing the kindergarten observation form, and they were also doing some other surveys. And because a lot of these, particularly the play groups, a lot of them went virtual, then that was very difficult to do. I don't have the previous report in front of me, but I believe we did have measures in previous reports. Lisa?
Yes, I think you're right. For several years, we did the kindergarten readiness assessment across the county, and we always would look at the data and match it with your service participation data, so we could pick out the children who had been in your preschool programs, who had been in your school readiness programs, were more ready for kindergarten. So that gives us a really consistent outcome measure for several years running. And we thought we got to a point where we don't need to keep demonstrating that because it was pretty consistent.
Well, I would just call this out because I think this, both of these things are, I think, very, very important. And it'd be useful to be able to justify what we do by having data that, which apparently we had before, and perhaps was affected by COVID or whatever. I can understand why it's difficult to reach a conclusion here, but I think as part of the evaluation, it's important to try to figure out that we can demonstrate to the public that what we did made a difference. And to see a chart that says, is anyone better off? And it says not applicable, or it just kind of stands out, I think.
Okay.
Thank you.
Comments. Thank you. Melissa?
So as I mentioned, we'll be moving on to the third priority area focused on ways to empower families' connection to communities and the ability for families to support children's development and safety. The 211 call center received more than 5,600 calls from parents and caregivers of children ages 5 and under, and 211 provided these callers with nearly 15,000 referrals to community resources. At follow-up, half of the families that were reached had accessed at least one of those referred services. And during 2020-21, First Five funded 14 community groups with community connections grants. Collectively, these groups held 170 meetings and reached about 700 families. The groups innovated efforts to maintain the much desired social support and connection while adhering to COVID health and safety requirements. So for instance, they engaged in social distance events, virtual calls, and shared ideas for family activities when more traditional avenues for play were unavailable. First Five began funding the Birth and Beyond Family Resource Centers in 2004 to promote effective parenting and address child maltreatment. In 2020-21, the Birth and Beyond FRCs reached about 3,800 families through light touch enhanced core services, crisis intervention, parenting education workshops, and home visiting. Birth and Beyond provided nearly 6,500 enhanced core services such as child development activities, peer support groups, life skill classes, and stress reducing activities, reaching 1,240 families. On average, families spent about 7 hours participating in enhanced core services. More than 1,900 families received short-term targeted crisis intervention services. On average, participants reported significantly reduced stress levels and had significant increases in their perceived support from family, friends, and their community after engaging in crisis intervention. And among the more intensive or recurring services, FRCs provided parenting education workshops to 545 adults and provided over 9,300 home visits to 932 Sacramento County families. Both groups had statistically significant improvements in their parenting knowledge and skills using the adult adolescent parenting inventory, which indicates reduced risk of child abuse and maltreatment. And additionally, as part of a larger evaluation conducted every 3 years for Birth and Beyond's recompete requirements for AmeriCorps funding, ASR conducted a quasi-experimental analysis exploring 12-month outcomes for children ages 0 to 5 who had an intake into Birth and Beyond home visiting between February 2018 and February 2020, and had a baseline CPS allegation in the 6 months prior to that intake. The slide I'll be presenting here focuses on these outcomes of a matched analysis for children receiving 8 or more hours of Birth and Beyond services, while the slides and the report pages that you currently have in your packet will show the information for those receiving any amount of service. The 8 or more hours analysis resulted in a sample of 196 children statistically matched to a comparison group of 196 children countywide that did not receive Birth and Beyond home visiting, but also had a baseline CPS allegation during the same time frame. Children were matched on key characteristics known to increase vulnerability for CPS recurrence in order to control for differences between the two groups. So within 12 months of intake, 6% of the Birth and Beyond treatment group experienced substantiated CPS recurrence. Meanwhile, almost 9% of the comparison group that did not receive Birth and Beyond home visiting experienced substantiated CPS recurrence. So this analysis indicates the impact of 8 or more hours of Birth and Beyond home visiting compared with no Birth and Beyond home visiting, as the Birth and Beyond treatment group were almost 30% less likely to experience substantiated CPS recurrence within 12 months. And this Birth and Beyond treatment group also had a lower rate of recurrence compared to countywide estimates. And as this mother describes, the support received from home visiting has helped her learn about herself and has helped her support her ability to advocate for her daughter's needs and what is best for her. The last program we'll be discussing is the Sacramento Crisis Nursery. The 2 crisis nursery locations serve 297 children in 208 families. Nearly 4 out of 5 participating in crisis nursery had stayed more than once at the crisis nursery during that fiscal year. 187 children stayed overnight for at least 1 night, and 238 children received daytime care. Parents and caregivers most commonly use crisis nursery due to work, distress, or their medical needs, and nearly all parents reached at follow-up felt better able to solve their crisis situations as a result of the support, and nearly all felt that crisis nursery kept their children safe and secure. And additionally, on average, parents reported significantly reduced stress levels after using crisis nursery services. Any comments here before we move on to the goals for the future?
Don't see any.
So this slide just highlights some of the main takeaways from the report. So first 5 should continue adapting to COVID-related health and safety requirements consistent with state and national recommendations, as well as the permanent shifts in programming that may occur as a result of this unprecedented pandemic. First 5 should also continue investing in systems change and advocacy work, such as the racial equity, diversity, and inclusion initiatives. And special studies also provide a valuable look at best practices and potential roadblocks in programming. Lastly, to improve data quality, completeness, and efficiency, partner staff should continue to be trained on the Persimmon database. And when possible, functions of the database should be adapted to increase ease of use and the availability of meaningful data while protecting client confidentiality. And that is all I have. So I'm going to go ahead and stop sharing and open for discussion.
Great. Thank you very much. Commissioner Wirtz.
Yes, thank you, Chair. Just a couple of comments. I appreciate Commissioner Wagstaff's comments about the non-available outcome data issues, and certainly the evaluation committee is always looking at ways to address that. So I think it's really important that you point those out. And I think it highlights the second point is that Alyssa did a great job of presenting a very complex, 70, 80 page document. So there is much more detail as Commissioner Wagstaff was sort of referring to in looking at that. So I urge everyone to look at that. I think there are some really great outcomes and some challenges. And if I could just take a moment, I do think the COVID time period did create a lot of challenges for the evaluation process. And I think we see some of the implications of that, of having a little less good data. But just to highlight, as we saw, the infant mortality overall showed improvements, but the disparities remain. That was one of the things. There were improvements with child abuse and neglect homicides, perinatal outcomes, and infant sleep related that we didn't necessarily get to highlight there. And just for the pregnancy peer support program, one of the consistent findings was that those who received visits and the BMU coach had significantly better outcomes controlling for many other factors. And I think that's a real positive indication. It was across all the outcomes, and so a consistent result that sort of suggests that this program was having the kind of effect that we wanted it to. And I think the Birth and Beyond Family Resource Center finding is one of the best evaluation data that we've ever seen for First Five, and I would argue around the state, that once controlling for as many factors as we could manage, or I should say that ASR could manage, and our team at First Five, substantiations were half the level of those who did not receive this intervention. So I mean, that's profound. I mean, that's just indicating that this program is having an effect. And that was for families, whether they received the 8 hours or not, that was for families that were getting referred there and getting engaged in that process. So that was, I wanted to highlight that. But I then wanted to just sort of quickly highlight that systems sustainability plan led to the Safe Sleep Baby 2.0 program, and that we had much leveraged funding, both from California First Five. But on the negative side, I wanted to highlight that I too was looking at the infant mortality rates are going up slightly. Progress seems to be stalled. That may be COVID related, but we've got to work on that. Prematurity and low birth weight, as Commissioner Wagstaff said, are not only still high and increasing, but there's still the disparity was increasing as well. So that's a red flag that we're looking at. In terms of breastfeeding, 70% of women in Sacramento are exclusively breastfeeding at the hospital. That's a substantial rate, but again, disparities exist there with Asian and African American. But again, our hospitals are generally baby-friendly designation as the systems change. So, and again, allegations and substantiations for child abuse and neglect remain substantial disparities. So one of the messages I guess I would get across for this is that we're moving in the right direction for our strategic planning to look at race and ethnicity as a central factor, because we, in multiple areas across this, our programmatic efforts, we remain with substantial disparities. So lots of great progress and lots of great challenges ahead. Again, I think the team with First Five and ASR as our evaluator and all the input from our providers has been really a valuable effort to try to make us as data informed and insightful as we can. So kudos for everyone for this report. I think it's a substantial report. It has a lot of great information that should help us improve our programming. So thanks to everyone involved.
I also want to thank our contractors for all of the time and commitment that they put into making sure that they enter data and that they keep, communicating with me on any issues that they may have. So thank you.
Okay, great.
Yeah, I just want to concur. This is Dave. I just want to concur with both those those comments, but I also want to commend our chair and leadership of the commission for the courage to take these things on in the first place. And it strikes me that one of the big changes we made is we dramatically changed the method of delivering services to the constituents, services to those that needed services. It's a dramatic difference from what used to be. And I think that's a model we can grow and look and look and look. And the other thing is we're building leadership among the people who are now doing that work. And those leaders will rise up and become leaders at higher levels. And I think so. It's a marvelous transformation. So congratulations to everybody. We're far from done, but it's a heck of a start.
Thank you, Commissioner Gordon and Commissioner Wagstaff and Commissioner Wirtz and Carmen. Appreciate all your comments, and thanks to the ASR team for giving a thorough presentation. I won't repeat what's already been mentioned, but suffice it to say that much of the evaluation is centered on, as Commissioner Gordon just pointed out, this commission's work and the county's work in tandem to address head-on disparities, long-lasting disparities, and the real numbers, the number of children that are dying in our community and from avoidable causes. And again, nothing could be more profoundly important than us being thoughtful about how we make progress and minimizing, if not eliminating, that from from our community. So again, I want to thank everyone involved. This feedback is absolutely paramount to us continuing to refine and hone even better processes and better public policy, quite frankly, and resource allocation. So it is of great import, at least to this commissioner, I'm sure to others as well. All right. Madam Clerk, do we have any members of the public that wish to address the commission on the presentation?
No, we don't have anybody signed up to speak.
Okay, very good. All right. Our last item for today's meeting is the commission members' opportunity to provide any comments. See none. I do want to just make mention of the fact that our very own Dr. Olivia Kasiri had the great honor of being selected by our local Congresswoman last week to be her virtual guest for the State of the Union. And that's a pretty great honor and something very well-deserved. Well-deserved for her continuing leadership throughout the pandemic. And so I sent a personal note to the Congresswoman thanking her for recognizing someone who, again, continues just to do fantastic work, much of it behind the scenes, and none of it easy. So I just wanted to end with my recognition of Commissioner Kasiri for her great work. Any other commissioners have comments?
Just wanted to say thank you for your support.
Absolutely. We all support you. Okay. If there's no further business then before this commission, we stand adjourned. Thank you, everyone. We'll see you in May.